So welcome to MEDtalkx on Pendle 103.1 FM. My name is Fahim Shakur. It's just gone after 8 p.m. This is a regular 1-hour show. Thank you all for joining us this evening. For those of you,
we'll do some introductions. So we are joined today by both Gillian Wood and Dr. Olufemi Sanni, who likes to be called Femi. So I'll start with Gillian. So she has got a vast degree of experience working in costume textile industry for film as well as TV. Interestingly, you've also released some short films. I did try to find them on YouTube and such forth. I did struggle, but perhaps you can guide me later, Gillian.
Yeah.
But you've also set up the Scrub Hub, haven't you, following the COVID-19 pandemic in your local area in Fleetwood and Clyde. So thank you so much, Gillian, for coming on. Our next guest is Femi. Now he's actually a previous colleague of mine. We shared offices not that long ago, but he has moved pastures new. So he's the founder and CEO for Steno Memorial Foundation, and is a consultant psychiatrist. He trained at Univeristy of Ibadan, which is the third most populous city in Nigeria, and subsequently worked in UK as a psychiatrist. So thank you for joining us, Femi.
Thank you for having me. Thank you.
So what's the agenda for him?
So yeah, I think the common shared feeling between both Femi and Gillian is the PPE. Obviously, Gillian, I think everyone watching and listening can see some of your items behind you, and as that's so eye-catching, shall we start with that? Tell us about what got you into the Scrub Hub and so on, and your fashion experience, and just really, what is PPE?
I am connected with costume professionals that work in film through Facebook. And I saw that there was a Scrub Hub set up in London, and I thought that was interesting. That was the first I heard of it. So I tried to find one local to me, and the nearest was Manchester and Liverpool. And because of the lockdown, it was going to prove too difficult to be connected to the group. It's just too far. And I looked for one in the area and there wasn't one. So I just thought, oh, well, I'll start one here, because with my background in costume, I knew basically what I needed to do and what I needed to find. So it all happened really quickly over a period of 2 to 3 days. We were already up and running, so very fast.
Excellent.
Wind.
Excellent. And I need to obviously say that you've provided me with scrubs as well, Gillian, so I'm very grateful. I know I've mentioned it previously. Happy to remind the listeners again. You've got some family who are in the medical field, and that also helped you to get into this field. Is that correct, Gillian?
Yes. My sister, she's a nurse practitioner, and her husband's a GP in Cleveland, which is 5 miles from where I am here. And they have a COVID pod outside the surgery, and a couple of the nurse practitioners were a bit nervous to not have any gowns or any clothing, so we sent some scrubs to them so that they could wear them going into the pod and then discard them when they came out, so this kind of thing. And it did generally seem to help with a feeling of feeling a bit more safe, or that you're not just wearing your own clothes all the time.
And I take it, Femi, you're doing something similar, aren't you, with perhaps in addition to where you work, but also back home, as you put it.
That's right. Basically what happened is I've never met her. She's a doctor as well. She worked in somewhere in Pool area, and she went on FundMe and trying to raise funds for people in Nigeria, care work in Nigeria. She's originally from Nigeria, another part of Nigeria. So there was it became an epicenter. The place is called Kano. It's probably Kano in Nigeria, another part of Nigeria. So she just thought, okay, she could raise about £2,000 to get a PPE. And after they contacted me, a friend of mine, Dr. Mukhtar Ahmad, he works in Poole, is a surgeon, and we went to the same university, and said to me, send me the link to donate. And when I saw it, so this is a very good initiative. So what I did was I donated, and I sent to a couple of friends as well. And she was able to raise this fund. What she then do was that she went to Nigeria and locally sought someone that could make a face shield locally, and which was very good. And they were able to, so they invited me into the committee, the steering group committee. Then I just looked at it, this is a huge opportunity to do more. So through Steno Memorial Foundation, I raised my funds and we partnered together, and we've been providing face shield for all the states in Nigeria. But basically, we can't do as a government. So even if it's 200 that goes to the frontline workers, something, because what we've seen is people have become very scared and very understandably anxious about seeing patients, and that has caused a lot of significant distress, basically, because people are seeing people dying, especially in some areas that people were not well educated about COVID-19 pandemic.
Yeah, no, that's really interesting, and I guess we don't really probably know a great deal of what's going on in Nigeria in terms of the cases, in terms of death rates. We do understand places like, say, for example, Brazil. It's really accelerating there, isn't it? There's the degree of number of deaths in a single day is, I think, it's surpassed America, which unfortunately is a leader in the wrong sense, and you don't want to be a leader in this. So it's, I guess the essence is about sustaining that kind of support, and it's great that both of you are really involved in supporting, personal protective equipment. So it's vital.
Yeah, like you said, in Nigeria is huge problems in terms of testing. As you can imagine, we're on over 200 million in population, and then up to now, I don't think we've been able to do up to 2,000 tests in a day, though they say they're doing more than that. But our case is still less than 5,000 cases so far. So, though it's good, the people are not dying. We have maybe about less than 250 people that have died of COVID-related deaths, which is good, but we're not sure whether this a true picture of the situation on ground, especially when we haven't got the capacity to test as many people as possible. That is the drawback. But I think education is the key, especially in developing world. Like you said, many places people are dying. People don't even believe it exists. So that's the problem. So I think a lot of education, people needs to be told in language they understand that this is a very deadly virus, and irrespective of anybody, no matter where you come from, your color, or whatever condition you've got, or you don't have, anything can happen and it can accelerate so quickly. And those are the concerns that we have.
Gillian, I want to come to you. Obviously, we need to know the nitty-gritty of making these scrubs to the mass orders. Can you tell the listeners and viewers a bit about the whole process from the start to the finish, from, say, someone like me gets in touch with you, emails you, and to actually getting the lovely actual garment? Tell me and go through it with me.
Well, first of all, we have a Facebook page, so people mainly find us there, and it's been a bit word of mouth. So I'll get the email, and there'll be a request. We need some scrubs. So I ask back, list the sizes that we do and the leg length of the trousers. So they're all a standard cut. It's a unisex. We don't do male, female because it's too complex, and we just had to keep it simple. So, for instance, it's quite sort of square in shape, quite loose. Originally, they had to be 100% cotton because of the high temperatures. They need to be washed. So the email comes in, and I talk with the medics and the hospitals to see exactly how many they want and the sizes. So I get the listing, and then there's a team of sewers, and they're dotted around quite close by, right in the filed area. And then I have to make the fabric order. So usually I'll make a bulk order. At the same time, we're fundraising as well, or at the same time to buy the fabric. And when the funds come in, I can go, and then we get rolls. So we were supplied by a factory in Burnley, and all the scrub hubs around the UK were scrabbling for fabric, because as the fabric's being used up, it wasn't being replaced. So that was quite difficult to source the fabric in the first place. So then I'd have rolls of fabrics either sent, they'd be delivered, or we'd have somebody, we had a team of drivers as well, that would be able to go out for certain times in the day to fetch the fabric or to deliver the scrubs. So we have like a relay system kind of thing. So once the fabric came in, then I usually supplied whole rolls to a sewer, because that cuts down contact of having to open the roll, cut it, handling, basically, we try to keep to a minimum. So the whole roll would go to a sewer, and then there would be a pattern, and that came from the general scrub hub, the central scrub hub website, where you could download a pattern. So it was on A4 printed pieces of paper that you have to piece together like a jigsaw, and then cut the pattern out of that. But that's really complex because you need a really good home printer. So that proved to be a bit tricky for some of the sewers. So a company very kindly printed patterns for us on the big A1 printers, so it came out on a roll. So we were able to send those out to the sewers as well. So that would be my part, was to organise the delivery of the fabric, distribute it to the sewing team, take in the orders, and then collect everything from everybody, and then distribute, get the orders put into bags and sent out to the various places. So the process, even for one order, is quite complex, and there's a variety of sizes needed. So I have to constantly calculate, we need more medium, we need more large, and it gets quite complex. And then we had sourcing colours. Everybody wanted this darkish blue.
Okay.
But we ended up with like bright green in the end. It went through all the colours of the rainbow almost. Because they weren't being replenished, the fabric, so we had to just get what we could. Yeah.
But Gillian, how?
Yeah, come on.
No, I was just going to say, how have you tried to? Because I guess there are some expectations on the environment to be kept in a certain way, to ensure that safety and the quality is maintained about the actual product that you're supporting staff with.
Yeah.
So how is that done? Because there may be some viewers or listeners who are not really too sure what kind of standards.
Before, when we put out the requests for the sewing team, it was crucial that you had a sewing machine and an overlocker, which encloses the seams professionally. So generally, if you've got an overlocker, you're of a good standard of sewing. So we'll just ask a little bit about the background. What have you done before? Couple of the sewing team had made a lot of things like wedding dresses and things for their children. So they were very competent sewers. And there'd be a couple that we had, one of the sewers called Peter. He sews a lot of the costumes for Funny Girls in Blackpool, which is a big show. So he was very knowledgeable. And then we had a tailor, and he was very knowledgeable sewer. So the whole team were already a very good standard. And like, for instance, just one I can show you, even had a really nice little embroidery inside. So that's the size. And then she put NHS in a heart. So everything's really beautifully made. The work is just fantastic. It's very robust, so it will stand lots and lots of washing. It was just, the quality is really amazing, and all the sewers across the board were doing really amazing sewing works. That was great. And plus, something like this, you have to cut it out, machine it, overlock it, press it, everything is quite time consuming. So yeah. But
so Femi, I want to bring you back in the conversation. You've been watching a lot about the PP in psychiatry. Right. You still need PP as well. It's not just the mental state examination, is it? So there is obviously a need. Tell us about what kind of PP you've been using.
Yeah, basically we use the face masks most of the time, except when we see patients that have confirmed cases where you use the full gear and you use the face shield and you wear the protective gear as well. Like what Gillian was showing us, we've had to change into uniform like that when we've gone to COVID wards. The wards have been confirmed as hot wards, and then we change from our own normal clothing. Then we wear the scrubs, and then when we're going out of the wards, go to the changing area, then we change back, we have a shower, things like that. Just going through the proper prevention and then infection control measures. So that's the basic things I would do in psychiatry, unless we go to that in regards to our own inpatient. If we need to go to acute hospital where there's obviously a COVID patient as well, then we go through their own process as well. From our side, our inpatient ward, there has been most of them are most elderly ward. There's a case of COVID or someone that's just recovered and come back, then we treat that ward as a hot ward. Just make sure that everybody's protected, and then they are being given appropriate PPEs.
And what's the situation like in care homes where you're working?
So basically, as you know, that under the government guidelines, we're trying to minimize contact in care homes. And if there's a need for you to visit a care home, obviously you want to make sure that you speak to the care home first and get the background information of what's going on in the care home. And if there's some care home has also put certain measures in place where they've actually kind of separated the residents and make sure that whoever you're coming to see, you have very minimal contact with other people, even including the staff as well. So you're just seeing that person, and whoever is the main carer or main care lead in that particular floor or section of the home will take the lead and provide them with the information that you require, rather than seeing different people. So that minimizes your contact as well, which is always good, because as much as possible, as you're going in there, even if you're COVID-free, you don't want to put other people at risk, and you don't want to come out with any significant infection, because it's either way. You don't want to transmit that, you don't want to get it. So you always protect yourself as well with PPE when you go in. We are going to the care home, you have to be fully cared, to be honest, because we know that we see people that are at risk age because of the pre-existing condition, and we also want to make sure that we protect them as much as possible.
Yeah, no, you touched on some very important points, and then I do hope after the break we will discuss some more pertinent things, especially when it comes to the BME, the risk assessment, the degree of exposure, and what needs to be done. I guess there's a lot more focus and attention given to it, and rightly so. But it's just making sure that people, especially frontline staff, are supported in the right manner. Gillian, not long ago, there was, and I do remember having a conversation about gowns. So obviously you guys support and do a lot of work with scrubs, and it's greatly appreciated. I still haven't seen Fahim don it on, but maybe I can try to convince him for the next show. But I'm pretty sure he does routinely use it. But what's the difficulty with gowns, especially when it comes to being exposed in in an environment where there may be fluid splashes or aerosol generating areas?
We didn't, we haven't, well, we made gowns, but the cotton ones, we haven't done any fluid resistant ones, because that's very specialist. With the fluid, it has to be a certain fabric, and the seams have to be sealed. And one of the sewing team that I'm working with, she's into that, because she's a professional seamstress, and she would understand how to seal the seams. So that was something I felt for the Scrub Hub. We couldn't really go into that territory, because then we had the the fabric that would stand high temperatures so that it could be washed safely. But going into fluid safety, that would be something else, because the fabric would have to be a specialist fabric. And also in the time frame, because the scrubs are winding down now as the factories start going back to work. So it wasn't really worth it for us to look into. It would have taken too long. I don't know what the position is with the gowns now and if they can be supplied, but I believe there is still something sticking along the way, that things are not still flowing fast enough. So the gowns, personally, I didn't feel that the filed scrub hub could really take on safely. So we had to stick with what we've got here.
Yeah, I mean, in terms of, obviously, we've talked a lot about the PP, but I think we shouldn't be remiss of actually the lockdown experience, Gillian. You know, you're one of our guests who's come on during 9th week now of lockdown, I think. So tell us a bit more outside of your work, just generally, how has it been for you?
I've been very busy with the scrub hub, really. So for me, I've had my head down and just been working really hard on that. But I've been like working in the garden and doing some writing and enjoying the nice weather, going for walks when I could. I like being outdoors, so I spent a lot of time in the garden, which was lucky. Basically focus for a big part of the really tight lockdown was working on the scrub hub. Excellent.
And yourself, Femi, what's your lockdown experience been like?
Same here. I've been trying to do a bit of reading, but since they eased the restriction, obviously, to do more exercise, I find myself going for a long walk. Before, I didn't used to walk for a long distance. Now I've been going for kilometers, 10, 20 kilometers work, and that has been helpful. And just trying to on the steam sometimes is always good to be able to have the opportunity to just clear your mind, because for a lot of people is a lot of restriction, and then we reacted to it in different ways. A lot of anxiety issues, and people really struggle with being able to adjust, which is the main issue. And also the impact in terms of people feeling as if they're normal, they were not in control of everything, even though they were still within the environment, but it seems as if the ability to control things have taken away from them. So it was very stressful for other people, and we all react to things different way. So I hope as things are easing out, a lot of people will find opportunity to do what they always enjoy doing, has always been meaningful to them, because we're going to see a lot of people with mental health conditions and exacerbation of their pre-existing mental health issues as we go along in this journey, because it's still a long journey, to be honest. We still have the COVID wrong, still pretty much so. So hopefully people will have some meaningful things to do and make them more calmer and more happier, because there's a lot to learn. Yeah.
Thank you so much.
Thank you.
We've been talking for just under half an hour, and I'm mindful of the time. So I think we'll be taking a short break. And when we come back before the end, we'll need your top 3 tips, Gillian and Femi. So have a think about that during the break, something to mull over. You've been watching and listening to MEDtalkx, and we're on Awaz 103.1 FM. We will be back shortly after the break. Thank you so much.
Thank you.
Okay. Welcome back, everybody. You're listening to the second half of MEDtalkx. We are being broadcasted live on Pendle Community Radio, Awaz 103.1 FM, and it's also being streamed live on both YouTube as well as our MEDtalkx Facebook page. So if you have any questions, please do ask. We will try to interact, and we will try to answer them to the best of our ability. But on to the next half of the show. Femi, I'm going to start with yourself here. We did talk about ethnicity and its vulnerabilities to coronavirus. Now, we do know, say, for example, in the NHS, about 30% of frontline workers are probably from an ethnic background. So there is quite a disproportionate representation on top of that, if you're vulnerable, what's the kind of mood where you work? Because you're not on this side of the shores, are you?
That's right. Just like in NHS, we know that the way the COVID pandemic, with regards to ethnic and Black minority, there's been disproportionate findings in terms of even mortality, and the people they've contracted this condition, and it's very scary, to be honest, because people can hear this in the news all the time. So there's a bit of anxiety there. Many people from the Black community or minority ethnicity, they have a pre-existing condition like diabetes, they have hypertension. Some people have even some condition that's still under investigation. So you can understand that can cause a lot of anxiety related issues. So, and that will impact on how people want to be in the front line, to be honest, especially when there was a concern raised and there was the need to do risk assessment before people can then be redeployed, because a lot of what happened from where I work is people have to be redeployed. So some people that ordinarily would have been in the front line, they have to telemedicine, just engage with patient on telephone consultation rather than seeing them face to face, depending on the risk. So those are the issues that have cropped up. Or by and large, I think people are still willing to do their job. People are keen to be supportive and to care for the patient, because primarily that's what we are as doctors, as nurses, and healthcare providers. And then so, at the back of the mind, everybody wants to be safe, and that's understandable.
Yeah, and we do talk a lot about migrant doctors, and there was a lot of conversations in the news, especially on this side of the British Isles, about their financial commitment and what allowances they can be made in terms of contributing towards healthcare and things. So I think the government have made some changes, and I think that's rightly so, following some pressure from colleagues or people from both sides of the bench. So as you said, it's always in the back of your mind, but at the same time, the principles as to why you were there in the first place still persist. And I think that's if you have the right culture and the right environment, people will still continue to flourish. And we have talked about resilience, haven't we, quite a few times?
That's right. Yeah.
I don't know what your thoughts and possible fears are about what it could mean in the future.
To be honest, it depends. You have to look at it individually. Like you said, some of these issues, sometimes people have to look at it in their own stand, what they stand to gain in terms of resources, financial resources, economic immigrants, for instance, doctors that have come from Nigeria, for instance, that have come to UK. You wouldn't just want to say, I'm not going to work. Are you with me? So that's an issue, but if, like you said, if the government is protective of everyone, then they will feel that they're part of the system, and that will give them that comfort. Even though if they're eager to be on the front line, then there won't be any significant or any disparity in terms of risk, and they will feel that, okay, we're all on the same front line, and we're exposed to the same risk, and we're all safeguarded at the same level, and that can help in terms of confidence and in terms of reassurance and in terms of how people discharge their duties. Because I don't know, but that will still be something researchers will do over time. I think in terms of our doctors discharge their duties, I don't think this COVID will really be in the front line. If people won't come to work, they won't come to work. The moment they are at work, I think as a doctor, like you said, the primary thing is to care for your patient And that's why we've seen a lot of doctors that have died from this condition, because they were just doing their job, as you expect. So obviously they contracted the condition based on the fact that when they were supposed to do what they were supposed to do, they did it and they exposed themselves. So I think the government needs to also step up and provide appropriate cushion and support for doctors, so that the family that are left behind are not suffering.
Yeah.
And same goes to all.
What are your thoughts on this sort of?
Just not
Yeah,
doctors.
Gillian, what are your thoughts on obviously this sort of thing and what it means for you know, the number of deaths, obviously, and the scrubs and what the government is doing? I mean, my scrub hub came. Did you think that was something that needed to come up, even if the government was doing its job?
Yeah, we were wondering why there was such a shortage and what was happening there, why the scrubs weren't available. Of course, it's not PPE really. I don't think it's classed as, because it's not the plastic and the viruses, but still, it was definitely a shortage, and the volume that's been supplied around the country, it's obviously there's something not quite working there. There were no stocks, or people were struggling to get scrubs, and people that hadn't worn scrubs before were asking us for scrubs, like in care homes especially. We've had a nursery, just single GPs that wouldn't normally wear scrubs were asking for them. So obviously not being able to get it was a bit of a feeling of panic. And really there's a lot of scrub hubs around the UK. So obviously there's a big need there, and something was stopped in the supply line very quickly. So I think that something that needs to be looked into really, because there was no prep. Obviously something just wasn't prepared, I think.
And with what Femi was discussing and the higher mortality that's been noted in the BAME community and so on, has that influenced or made an effect on the orders you've noticed? For instance, do you do any research data gathering as to who's ordering, their ethnicity or anything? Do you have any ideas of any information that way?
Not really, because I think it depends on what area you're in, because we supply very locally due to transport issues. So it's really the main hospitals here and local GP surgeries. So it's people that would be from the area, not anything specific, very across the board actually. And not really supplying many hospitals. It was mostly GPs, care home.
Sure.
Yeah, and I think there may be some additional requirements, especially with NHS trusts. So we were, my father-in-law actually wanted to try to support a local NHS trust, but with gowns, for example. But it's going through that process of to actually make the necessary standards and quality of gowns being produced was a challenge. On top of that, as you said, there is clearly a demand, but there's also something stopping the supply. So it's for a general public to try to mobilize. It's something very difficult. But I am curious about, I guess, your workforce, your colleagues. And I don't know about everyone's circumstances, may be quite different. People have been furloughed during this period. There may be some expectation that they need to return to back to work as things start to, in terms of the restrictions, they start to reduce to some degree. I don't know if that means that the capacity or the ability to mobilize and support by charities such as yourself is going to be hindered because of that. Yeah.
We did have a few furloughed people sewing, and a couple have been right from the beginning. Some people came and went, and we had to put a call out three times to get more people to sew, because the situation was changing all the time. So we just had to keep on top of that, and sometimes we needed to expand a little bit. We've had a few people there from the beginning, and one lady, I think she's furloughed, but she's not sure if she's going back to work, so she's still going. She's been with us for weeks. So it's given her something to focus on as well, I think, and her work's amazing. So that way, it was great, really.
Yeah.
Femi, obviously, as a psychiatrist, we couldn't let you leave here without giving us some psychiatry help for the listeners and the viewers. So obviously, Gillian's explained working hard and focusing on something is probably how she's been getting through it. But not everyone has that luxury or even ability. People are at home and, not able to actually do something. But can you suggest what else they can do to keep on top of this pandemic, to keep their mental health well?
Yeah, I think the most important thing is people have to do something within their own comfort environment to start with. You have to engage with family and friends that are close to you. And that's very important in terms of re-engaging, reconnecting with people, the loved ones. Very important. Another way to look at it is looking for something meaningful to do. Even just like what Gillian said, she got herself what she's doing and she focused on that, and that's given her some kind of stability in our own world. Some other people will love gardening, some people will love reading, some people will love just sewing. There's little things. Some people can have maybe just develop interest in artwork. Some people now are developing interest in YouTube and learning music, doing some other interesting thing they've put at the back of the list and now coming up and looking at how they can do that. And because the time is there now to do a lot of wide range of new things that can be new hobbies and that can be meaningful hobbies and very smoothly and things that will make people happy, so to say. Another way to do it as well is to try and not to feel pressured and think, oh, I have to do this, I have to make a decision now. This is not the time to make a quick decision. This is the time to live and just be safe. Just keep safe, do the little you can, but obviously people remain focused in their drive, in their own personal ambition. But of course, there's so many things that are limited now. So in the context of that limitation, we also still want to strive, but in a way that we not feel pressured or driven by anxiety or fear of failure. So it's just about living and being happy. That's the most important thing that I think.
Excellent. Yes, please.
So, Femi, I guess with your circumstances, your family's in UK, isn't it? And a lot of our support network and life is pretty much focused on sight and hearing. So that there's nothing you can't reminisce about a specific dish or what that means, or you can't meet family in terms of that kind of intimacy, that interaction. So I just hope at the end of it, people value and appreciate and actually be grateful. I think being grateful is something that, and we have to be mindful. People have had difficulty. People have lost loved ones here. So I'm not trying to preach to them, but everyone's journey throughout this, lockdown as well as restrictions because of COVID, there should be some benefit or something good that comes out of it.
That's right. I agree with you, and that's why people have to. A lot of people are going through a lot of reflective mode and trying to reprioritize things and in their own little way. And it's just about being happy is very important, and also making sure that they're having adequate sleep and rest, and any exercise we can do as well, no matter how little, it will help with our mind and our mental state. Is very important, and we should drink little alcohol and not drink too much alcohol, and just make sure that we're
laughing there, Femi.
Continue to, because this opportunity, the time is there. When you're not doing a lot of things, you can do negative things. So it's always good to think about how would this impact on me. That's the first important thing that we need to think. Anything we're doing, we shouldn't do in excess.
Some good wise tips there, I think, Femi. We'll need to get you back on for this sage wisdom there coming out. Gillian, can you give us any other tips as well for the audience? The listeners have obviously been hearing what you do. They might be inspired by it. They want to do something because obviously this pandemic is ongoing. Can you give any ideas for the audience what they could do, spend their time constructively like you have?
I think it's always when you feel like you're doing something and you're doing something to help when it's in this climate. I think it does make you somehow takes the pressure off your own feelings of what's going on, because you're doing something, you're absorbed in it, and it's the process of doing something that I think helps your mind. There's as far as the sewing goes, I know that now there's people are wearing face masks, and a lot of people are making the cloth face masks, and those hubs are starting up now because a lot of those need to be provided. I can't comment on what that actually does, but you see a lot of people wearing them, and people maybe feel more secure to wear them, or I don't know, but that's a different territory that we won't continue with, but I know that that's happening. But I think feeling that you're contributing something or helping in some way, I think just gives you a feeling of, I don't know what, but it kind of makes you feel better somehow, that you're doing something active and that is helping in some way.
Yeah, I'm glad you mentioned the face masks. I was reading about these ones where it's actually transparent and you can see people talking as well. That's coming to for people. Yeah, exactly, for me. So people, if they're maybe, because then you can see what they're saying, and that's the new form of face mask. So I think that might be taking off in the future. And there's a lot of avenues in this industry, it seems, at the moment. In those sort of situations, so that's good. Any top tips, Gillian, you'd give the audience as well? I did mention before the break we like our top 3 tips.
About top tips for?
Well, the top 3 tips as to, in terms of just coping with the pandemic that we normally suggest to people, or even from today's discussion to take out.
Well, I definitely think we're very lucky at the minute because the sun's shining, and that makes you feel better. Even just to be outside, it just, in some ways, it's good that it hasn't been raining for the last 2 months, and we'd have all that to deal with where you're forced, you can't even go on your hour walk because it's, it's cold and it's rainy. We've got the sunshine, and there's some benefit in that, really. For me, that's a big thing. I feel better when the sun shines.
Don't we all?
It almost feels like divine intervention, doesn't it? Pretty much since the lockdown started, the sun has been shining. It's very unusual for this part of the world.
Yeah. And just the simple things, I've just liked the simple things, like I've done more cooking, I've been growing things. I'm lucky that I have a little garden. Walking and looking around at things I wouldn't normally notice in the area. Just enjoying the small things and keeping reduced, but yeah, that's 2 tips, isn't it?
Maybe we need to come back to you, Gillian. Femi, your top 3 tips from today's discussion, things that you want the audience to remember and imprint on their minds.
Yeah. I'm going to go with Gillian. The audience, we should look at what we can do to help. Anytime you do something good, you feel good. And then that helps as well, because good feelings is what brings about joy. Also, being aware of things around you, just like what Gillian said, little things you might, aware, maybe just walking around in the garden, seeing the plants and identifying things, and that can help with your mood as well. What you can change as well is very important. No matter how little things you can change positively, that's the key. It's about the mindset, positive mindset. No matter how little baby steps you want to take, just make sure it's positive. And any kind gesture, maybe somebody next door, any whole person, maybe charity work, no matter how little it is, it gives back that good feelings, and that helps. And then I'm always very passionate about giving, just like what Gillian is doing, the PPE, just like I said. And then we called it the COVID Nigerian medics. So it's all doctors in diaspora in Nigeria that are trying to support doctors back in Nigeria and healthcare workers. So things like this, he has given me a lot of happiness in myself that we're doing something back home. And I'm sure when people do things like that, they get joy and happiness back as well. So
great. What about you, Fame? Tips? Because I think we must have given about 20 tips already, at least.
I think in terms of tips, it's important to, I find it useful doing this on a weekly because obviously I'm able to engage with the new guests and I'm learning things. So for me, it's like any form of things that we do, voluntary work or charity work. Sometimes the person giving also gets as much as the recipient, but in a different way. And I think that's the change in mindset. Often it's you think it's just the recipient who gets something, but actually it's not. It's the one who's also doing it that they get that. So I think that's an important takeaway concept for the audience to bear in mind. I think also this concept that both of you have shown of just being constructive and positive and doing a project as such. This whole Scrub Hub, if you think of it as a discrete project, which you've used your skills, Gillian, to actually get involved with. And I think we all have these sort of skills at home. We just need to find what they are. Whether it be actually sewing or comedy, radio or talking. There are so many things that people can do if they want to do, cooking meals and so on. There's a lot of things going on in the community. And the pandemic has really shown the good side of people's personalities. And I'm inspired by you, Gillian, which is why I wanted you on the show, because you've really shown me what, people can do up and down the country, and you're doing it as like a full-time job, really, and really that's been very inspiring. For me as well, I'd say.
Yeah, no, same here. So there's so many positive stories that you could write countless novels during this whole period of people being very altruistic in terms of their interaction with the community, taking any grief and converting that into something positive. I think it just adds another layer of commitment, some determination. So it's great to have you both showing exactly what you do. I think from my perspective, something to be mindful of is that obviously ethnicity and the increased focus, never is there, this is not a time to suffer in silence. So obviously raise whatever concerns that you have with people that you work with your line manager. And there's, and NHS trusts are looking at this, and there is a risk assessment. So they will acknowledge whatever questions you may have and look at proactively saying that, okay, you know what, these are your skills, this is where you're best at, how can we support you delivering those kind of qualities? So there's a lot of support, there's a lot of enablers out there, but you won't be able to access them sometimes without actually saying something. So just be driven, just be vocal in the right manner.
Excellent. We've talked about a lot of serious topics. I just want to try and move tangent just slightly for the last few minutes. I know, Gillian, you have a background in film, so I was always burning to ask you, what's your favorite film, Gillian? You've got to tell us. And what should we be watching at home?
My favorite is quite an old film. It's by Steven Spielberg, called Jewel. And it's about a truck that chases a man in a car, and that's the whole film. And it was his first feature film, but it's always been my favourite film. I watched it when I was 15, and it's still my favourite film.
Excellent. Femi, what about yourself, Femi? We need it from you.
No, I've just been watching some Netflix series, to be honest. So, which one have I been seeing lately? I've seen a couple of them, to be honest. I've lost count. So I don't have any particular one.
It's like you don't want to share them live. Put you on the spot there.
It's like binging of them. I don't really.
Don't worry, we make no judgments on what you watch. But I say that tongue in cheek because I know for some people that has been a form of escapism, and it's another form, isn't it? The entertainment world has really taken off. There's been a Netflix series and so on, along with internet companies, obviously, and so on, that have really done well. There's certain things which have captured the imagination. So thank you both for coming tonight.
Thank you very much for having me.
Thank you. Thanks for having us.
Thank you.
And just for the listeners and viewers, next week, hopefully we should be having Dr. Suhaib Mohammed. I hope I've pronounced his name correctly. He's a dentist in Yorkshire, and we'll be focusing predominantly on dental hygiene, as well as other avenues related to dentistry. So thank you again, both. I hope we do keep in touch, and hope you're well and safe.
Thank you very much.
Thank you. Excellent. Thank you, everyone. You've been watching Med Talks on Awaz 103.1 FM on Tuesday nights, 8 till 9 p.m. We've had Gillian Wood and Femi as well. Thank you so much for giving your time this evening. It's been a pleasure. And the whole hour has just whizzed past this evening.
Yeah, that's good. Very interesting. Thank you very much for the time.
Thank you.
Thank you.
Thank you so much. Good evening.
Bye. Bye.